In this video, I'm going to discuss the rupturing of membranes, how that might happen, and some options that you have when it does. So first I want to discuss the premature rupture of membranes, which is also known as PROM. So this is whenever your water breaks before the onset of labor. This may happen in a leaking way, or it may all come out at once in a gushing form. What this means is that the amniotic sac has broken and the fluid that surrounds your baby inside the womb are leaking. You'll know that this is happening when you experience some kind of leak or gush of fluids, and you'll know the difference between the amniotic fluid and urine by the smell and the way it looks. Amniotic fluid has more of a sweeter smell, or it is unscented. So once your water breaks, you want to make sure that you call your doctor or midwife right away. They're probably going to want you to come in to prevent infection. Some things that could cause your premature rupture of membranes is infections in the uterus, cervix, or vagina. It could also be because there is too much stretching the amniotic sac, or that you've been smoking during your pregnancy, or it could also be because you had a biopsy of your cervix. Once you've arrived at the hospital, they'll check your cervix to see if you're dilated. If you're not dilated, they may want to induce your labor by use of IV medications. The risk of infection increases the longer it takes for your labor to begin after your membranes have ruptured. This is where your decisions get to come into play. The doctors may suggest that you be induced, but you also have the right to make the decision to let your body progress itself. And then, once it becomes emergent, then they would make the decision for you. So some ways that you could possibly be induced are first a cervical ripening balloon catheter. So there are two different ones. There's one that has 2 balloons and there's one that has 1 balloon. But basically a balloon is inserted inside of your cervix and it's filled with saline, which will then inflate and put pressure on your cervix to allow it to dilate. So if your cervix is not dilating, they may suggest this as a method to help dilate it to progress your labor. Another option is to receive vaginal prostaglandin. This is inserted into your vagina and it helps soften your cervix to prepare you for labor. This one is thought to be more of a natural way of helping the vagina progress for labor. You can get several doses, and then once that cervix is softened, they may want you to have some oxytocin to start contractions. Or again, you make that decision on if your cervix is ripening, and then maybe you want to see if contractions will start yourself. If you are less than 34 weeks and your amniotic sac has ruptured, the doctor may want to put you on bed rest if there are no immediate signs of infection, and they may give you antibiotics to prevent infections. They probably want that baby to stay in there as long as he or she can, and they may give you some steroid medications to help the baby's lungs grow more quickly. And then once those lungs are developed, they may want to induce your labor. Next is the spontaneous rupture of membranes, which is when the amniotic sac ruptures on its own without any interventions. This can happen before the onset of labor. Once your water has broken, you and the baby will be monitored. And if you're in the hospital, you'll have the choice of allowing your labor to start spontaneously or to be augmented through active management. So once your water has broken, if your labor is progressing on its own, the doctors may not want to provide different medications to progress the labor, but you do have the choice to have active management or spontaneous management. So basically, active management of labor helps to shorten the length of the labor and includes interventions to aid in the shortening of labor and minimizing abnormalities during labor. So this may be the use of Pitocin, oxytocin, different things to help those contractions progress and help the baby come faster. Spontaneous labor is a labor that starts on its own and it has no medical interventions. So expectant management is just the watchful waiting and monitoring. There's no immediate intervention, and it allows for the pregnancy and birth to progress on its own. Last is the artificial rupture of membranes, which is a procedure that's performed by a doctor to help progress the labor. They do this through an amni-hook or with their fingers. They may do this because the labor has stalled, or to allow for internal monitoring of the baby, or even to see if the baby has passed the first bowel movement in utero. Once those membranes are ruptured, they may want to see if the labor progresses or if they'll induce the labor, and you'll have a decision in that just as any other time when your membranes would be ruptured.